Hi everyone, welcome to another themes video. Today we're going to talk about the social determinants of health, or otherwise also known as environmental determinants of health. So if you look at this picture here on the left, do you think that these people will have a good health considering their living conditions? What is the chances of them having good health? Um, yeah. Okay, also, for many years we thought that the decrease in mortality rate was directly correlated to the use of antibiotics. But there was a Scottish doctor um, whose findings showed that the improved nutrition and sanitation might be the main cause in a of um, decrease of mortality. As you can see, improved nutrition, improved sanitation, and then the antibiotics were used. Um, so yeah. So what are social determinants of health? It is basically the circumstances that we grow, we live, we work, and we age. In what circumstances? So it is the conditions in which people live and work can create or destroy their health. Lack of income, inappropriate housing, unsafe workplaces, and lack of access to health care systems are some of the social determinants of health. So, social determinants of health is where we grow, where we work, or the circumstances in which we grow, we work, we live, and we age. So, globally, socially disadvantaged people, so people in a lower social slash education slash occupation slash income group, get sicker and die earlier than people in more privileged positions. Okay, so um, so social health determinants are health inequities, and also one should distribute resources um, equitably, not equality. Um, and the difference is equality. Equality is where you distribute resources equally to everyone. Whereas in equity, it is you should distribute the resources in such a way where there is more need. So people that don't need resources, such as the man here, you can already see over, he doesn't get resources, and this one needs one block and this one needs two blocks in order to achieve their goal. Okay, and just to emphasize that the socially economic positions really does have an impact on the health of a person. A child born in Japan, which is a first world country, great economic position, has a chance of living 43 years longer than a child born in Sierra Leone in West Africa. So this just so shows what an impact socially economic positions have. And children living in low income countries have a significantly greater chance of dying before the age of 5 than those living in high income countries. Okay. Also, I wrote here in poorer houses, the chances of malnutrition is significantly higher, which makes sense. So, yeah, once again, social determinants of health are the circumstances in which we grow, we live, we work, and we age. So if you look at the social economic status of a person, it will be the education level, the job, and the income of that person. And this social economic status will influence where you grow, you live, you work, and your age. So once again, what is the social economic status? It's your education level, your job, and your income. So yeah, I also wrote here, the environment where we live is also affected by our social economic status. Millions of people die every year due to weak, unsanitary environment. And when you have a weak or social economic status, then you will probably have a bigger chance of living in an unsanitary environment. So yeah, where we work also affect our health, such as dust, chemicals, noise, biological, mechanical, physical. Gender is also a social determinant of health. In some cultures, there's a stereotype of what a man and a girl should be, and that can influence their health. Um, I also wrote here, if one is blessed with a good social economic standing, this does not mean one has perfect health. It only means that your chance of having better health are greater, or having good health is greater. So, athlete lifestyle can also be a problem. Due to this sedentary lifestyle, people sit behind computers and things like that, not really active. You'll also be predisposed to use fast food or junk food. You'll also maybe undergo a lot of stress, and this can lead to substance abuse. You can also be affected by pollution. So, all the social determinants of health are upstream. The healthcare system and workers need to solve the problems that the patient obtained upstream. So, what the patient picked up in his living conditions, or what the patient picked up at work. So, it's upstream. So, more doctors in South Africa wouldn't necessarily change the overall population health, but better socio-economic circumstances as well. A doctor can only treat one patient at a time, whereas a change in the socio-economic standings of populations will have a major effect on the health of a population, millions of people. Um, so the social economic status of a person is a very key determinant in their health. Thank you for listening to this video on the social determinants of health.